Hi, and welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the first video in the exercise program titled Arthroscopic Knee Surgery, program number 1. I want to talk to you today in this video as if you were just sitting in front of me in my office so that I can address and tell you all those things that I would tell someone who's just had this surgery done. When I see someone after this surgery, it's usually the next day or anywhere up to 2 to 3 days after the surgery. So the first thing I'm going to do is take off the bandage or dressing if that's still there, and then I'm just going to take a look at the knee, make sure that everything looks good and it looks normal. There's going to be some swelling and some bruising, and then that is part of the normal process, but I just need to make sure that it's at a normal level. I'm also going to see how well the knee moves, so how well can you move that knee and bend that knee. And then I'm going to give you some good exercises that you can start on, as well as try to answer any questions that you have now that you've been through this surgery. The first thing that I will generally tell my patients is that your job for the next 3 days is to really take care of this knee. And you can do that by resting, icing the knee, elevating, and exercising. So let's talk about each of those aspects independently. So what about that rest? What does that actually mean? And what I find is that my version of resting is usually a lot different than my patient's version of resting. So in general, what I have come up with over the last 25 years of treating patients after this surgery, I find it's most simple when I say, I want you to rest and elevate that leg. Again, this is just for those first 3 days after surgery, but I want you to rest and elevate that leg most of the day. You can be up, so you can sit up for meals, so 3 meals a day, and you can also walk around just inside the house a couple times during the day, as well as just get up and walk around so you can go to the bathroom. So just that alone is going to give you the rest that you need and help decrease the swelling and pain. It's going to give you less pain and also help you sleep a lot better. So this just leads me right into that elevation part. So I said rest and elevate that leg. So elevation is really important to talk about too. I find that patients don't really quite understand what that true meaning of elevation is. So in order to elevate that leg, to actually decrease swelling, that's why you're doing it. That's why your doctor and the nurses will recommend elevate that leg. So a lot of times I just have people say, well, what does that actually mean? So when you're elevating a leg, you need to make sure that your head and chest are lower than your leg, or that leg is higher than your head. And in order to do that, laying down on a couch or on a bed is the best. So that way you can get 2 or 3 pillows up under that leg. And when you put the pillows under your leg, you want to make sure that the pillows are lengthwise, so not across, but lengthwise, and that the pillows are supporting your foot and heel as well. The third aspect that we need to talk about is the icing. Your doctor will want you to ice that knee within this first 3 days, and really even up into that first and second week. But they'll want you to ice that knee 3 to 5 times a day. So especially during these first 3 days. And that's really easy to do because your main job is just resting and elevating. So you're going to slap some ice on that knee several times a day. I tell my patients that I want them to do that for 12 to 15 minutes. It does not need to be any longer than that. But you do want that ice to get really nice and cold. So if you're used to icing that knee and you just put that ice cold pack or just a bag of ice right on that knee, and that doesn't bother you, that's fine. You can just put it right on there. If this is newer to you, then you might want to have a layer of a thin layer between your skin and the ice. So what I do for my patients in the clinic is I just put that ice bag or a cold pack, I slip it right inside of a pillowcase, and then I put that on top of the leg so that there's just that thin layer between you and the ice. And again, it allows that ice to get really, really cold. The last aspect that we need to talk about is the exercising. So if you were in my clinic today and I was seeing you shortly after this scope or this knee arthroscopic surgery, then I would also instruct you in some good exercises that you need to do to get that motion going and to get you back to walking normally and eventually back to all those things that you haven't been able to do since you've been having some knee pain. So on the website, you can find, after this video, you can find all the exercises that you need to get you through this process. So this first exercise program is going to be the exercises that you need for the first 7 to 10 days. After that, there is exercise program number 2, and that'll get you through 2 weeks after that. And that really should be about what you need to get through this process. You may need to continue with some of those exercises just depending on how the process is going for you. If you're not really out of pain, or you're not walking normally, you're not quite back to the things that you need to do, then just continue with those exercises another week or 2. Make sure that you're following up with your doctor. This exercise program, these videos are by no means to replace seeing your doctor, so make sure you see your doctor as you have scheduled. The last thing I just want to add about exercise is if you do have a stationary bike at home, then I want you to use that stationary bike. I usually will tell my patients to add, or I'll add that bike to their program anywhere from 3 to 4 days after surgery. The bike is a really good way to decrease swelling and just get that motion back, get you walking normally again. I generally tell my patients to start with 5 or 6 minutes and then just increase that gradually up to 10 to 15 minutes if you're tolerating it well. Now that you know you can expect some swelling and some pain, and you know what to do for those first few days, a lot of times my patients will then say, well, what about after those 3 days? And how much can I be up? What can I do? So I generally will tell people they can definitely be up more. You can be up for those meals, and after your meal you can stay sitting up for a little bit longer, half hour or hour after that. You can also just be up walking around your house a little bit more as well. Try to avoid getting in your car and going somewhere as much as you might really need to get out of the house. You might be going a little stir crazy, but try and avoid that for the first 7 days. If you can do that, I guarantee you're going to just feel better, and by the time you get to that 7-day or that 1 week mark, you're going to feel much better, and you'll actually feel like going out and doing some things. So generally I say the nicer you are to that knee in that first 7 days, the nicer that knee is going to be to you. You're going to sleep better, you're going to have less swelling, and you're going to have less pain.